The latest 2024 to 2025 HSE figures examine the financial impact of workplace injuries and work-related ill health across Great Britain. These costs highlight the scale of the issue, not just in human terms, but in economic terms for employers, individuals, and the wider economy. According to the HSE, the total annual cost of workplace injury and new cases of work-related ill health in 2024-25 was estimated at £22.9 billion. This figure excludes long-latency illnesses such as work-related cancers, which would push the figure even higher. Breaking this down further, £16.4 billion was attributed to new cases of work-related ill health, and £6.5 billion were due to workplace injuries. These figures were adjusted to 2024 prices, ensuring they reflect the real economic impact of today. The HSE cost model considers a wide range of factors. Costs are grouped into financial costs and human costs. Financial costs include loss of output, healthcare costs, compensation and other payments. Human costs represent the monetary value of pain, grief, suffering, and loss of life, the impact of people, families, and communities. When we look at who bears these costs, the picture is striking. The burden is not shared equally, as individuals carry £13.4 billion of the total cost, and the government carries £5.2 billion, and employers carry £4.3 billion. This means that workers themselves bear the greatest share of impact through loss of income, reduced quality of life, long-term health effect, and personal suffering. The breakdown of incident types also shows the scale of ill health relative to injury, with 72% of the cost from ill health and 28% from injury. This reinforces what we have seen across other stats. Long-term health conditions such as stress, MSDs, and respiratory disease have the most significant financial and human impact. The long-term view of the data shows the overall cost trend from 2004-05 to 2024-25. While the figures fluctuate, the long-term costs remain high, and the pandemic years introduced additional uncertainty to the data set, highlighted by the shaded areas of the chart. These stats make it clear that health and safety isn't just about compliance. It's about protecting people, preserving well-being, and avoiding enormous financial and human costs. Investing in effective risk management, early intervention, and workplace well-being reduces suffering and makes economic sense for every organisation.